I lead a team of pharmacists and technicians who provide pharmaceutical care management. This means we provide care coordination for our members. Our pharmacists review medical and pharmacy claims, which includes the medications that the members are taking and the diagnosis for why they're taking the medications. And we're able to identify areas to optimize the drug therapies or areas to save the member costs.
So you think about your pharmacy benefit that you have, the card that you have that you go to pharmacy, or you might have home delivery or whatever it might be, and the benefits behind that. So constructing that benefit structure, the overall formulary of drugs behind that structure, the cost of those, the programs, the clinical programs that support all of that, those all make up the overall pharmacy benefits for our commercial customers.
Navigating healthcare is not easy. When you have pharmacy carved in and we have line of sight, we can improve health outcomes on both sides of the benefit.
And so we really take a focus and approach with our members as well as our employers to meet them where they're at in their healthcare experience. And that experience is medical and pharmacy. And how do we put those puzzle pieces together to make it an integrated model? And there's value in that. There's solutions within that bring forward better health outcomes on improving the overall health care of our members. And we're incredibly steadfast in connecting medical and pharmacy benefits, where employers can really unlock the full potential of lowering their healthcare costs, right? And where they can improve their employee healthcare outcomes.
For me as a family physician, I've always looked at things needing to be integrated, because I'm a primary care doctor. I don't, just treat the left hand. My job is to make sure that the left hand is connected to the right hand and left foot and the heart and lungs and everything working together.
Our team actually worked on an outreach where we tried to find members who got a first fill of a medication and didn't get the second or the third one. So that timely intervention in identifying that members have stopped that medication helped us intervene, even reaching out to the members and talking to the providers on why the medication was stopped, if it was because of side effects or the cost issues.
And so there's a lot of clinical work that needs to be done with the benefit design for that member. And so in an integrated model, we have so many streamlined pipelines that have been built out where we're supporting that member through that journey. And at the very end of the day, what we really want is compliance and adherence to a medication, because when they're adherent to medication, they're managing that condition. It goes right back to the doctor who's seeing them, and we have completed that continuum, that member journey.
Having pharmacists collaborate with social workers, case management nurses, and in some cases medical directors to provide our recommendations as experts to help improve members' medication therapy and overall reduce costs, healthcare costs for the members.
If we even step back further and think about the overall healthcare spend, right, for chronic conditions, continues to go up year over year, and certainly has a strong correlation to those, specific chronic conditions as it relates to pharmacy. Let's say if diabetes, for example, that's a significant care category. And the diabetic care drugs, right, are a key driver of overall pharmacy spend. And so there's a lot of opportunities there, because you can't just look at diabetes as just sort of a pharmacy. It's a macro healthcare challenge, a significant challenge that we all have to face. And so that sort of intermediation across medical and pharmacy are key. And so you think about the employers, right, and what they're facing, and they're looking for strategies to address these chronic conditions and the costs that are associated with that. So what kind of strategies are they looking for to ensure that their employees are staying healthy, right, that they're having full access and focused on access to care, better health outcomes, and lowering overall costs related to many of these chronic care conditions.
When they see that level of engagement, they're going to see the value, and they're going to value that relationship as well. And they're going to understand, this is somebody that's doing this for my benefit. And anything that we're doing to benefit our members ends up benefiting everybody. It benefits our providers, it benefits our employers, and it benefits us.